this study, we essentially looked at 2,200 patients that had prostate cancer, and based off of the social determinants of health survey that the patients filled out, we looked into whether day-to-day discrimination scores, whether neighborhood characteristics, or whether food insecurity or supportive relationships had any impact on their overall perception of health. And in the study, what we found was that with every unit of increase in their day-to-day discrimination score, which is essentially saying that the less discrimination that these patients face, their overall perception of health goes up by 4%. And the same things were noticed in if the neighborhood characteristics were improved in these patients, every unit of increase in their scores, meaning the better neighborhood these patients lived in, their overall perception of health improved as well. So this had a direct impact on essentially policy making and sort of understanding what are the targeted interventions in this patient population. Next, we have our bladder cancer population, where we also looked at something similar, where we looked at their social determinants of health, and we looked at around 600 patients who did the SDOH surveys, that is the social determinants of health. And in these patients, we found out that there was neighborhood characteristics as well as food insecurity were the two factors that were majorly complicit in determining their overall perception of health. And we found out that with each unit of increase in neighborhood characteristics, meaning worse or improving neighborhood analysis showed that these patients had better overall perception of health. Again, this underscores the most important part, meaning that if we have targeted intervention in the social determinants of health, these patients might have improved overall perception of health. This also ties into an important portion, which is the IRA Inflation Reduction Act that is going to be a part of Medicare Part D, where now we will be seeing patients will have an out-of-pocket cap of $2,000. So we are really looking forward to the impact of these interventions in improving overall survival for our patients, especially the minority patients.